that even as we have lost the 2 million, as a country, we still have an estimated 1.5 million Kenyans who are currently living with HIV and whom we cannot forget and must continue to work together with them to ensure that they survive to live a lifelong, full life. Some of them have shared selflessly their experience in order to serve as a beacon of hope to others, that one can still enjoy a long and indeed fruitful life. I'm happy to note that our combined efforts as Kenyans has turned our country's story to one of hope rather than despair. Indeed, as the Principal Secretary has said, the number of AIDS-related deaths in 2013 stood at 58,456. This number has come down to some 19,486 so far, a reduction of 67%, but still accounts for loss of life. We are encouraged by this performance, attributed to the increase in the number of people on life-saving antiretroviral treatment that rose by some 83% from some 656,000 Kenyans to today, where we have 1,199,000 who are on antiretroviral drugs. Kenya's significant investment in HIV prevention has clearly borne fruit. Indeed, new HIV infections have been reduced by about 68.4% from around 101,488 to the current 32,027. Consequently, the HIV prevalence rate has come down from 6% to the current 4%. Kenya is among the African countries leading in achieving universal access to antiretroviral therapy for HIV management, and we also lead the pack in providing more optimized treatment regimes to prevent HIV transmission and to prolong the lives of our people living with HIV. We have also witnessed tremendous citizen selflessness through their voluntary participation in cutting-edge research, resulting in breakthroughs in prevention as well as treatment. The most notable has been the increase in prevention options through the HIV, pre-exposure, prophylaxis, and the daprovine ring studies for persons vulnerable to HIV. In 2014, my administration also introduced access to free maternity through the Linda Mama program, and as a result, skilled birth deliveries have increased from 57% to 78% in 2020. This initiative also increased antenatal clinical attendance by 18%, where HIV diagnosis during pregnancy is a prerequisite for admission to the program. Because of this initiative, mother-to-child transmission rates, though still high, have reduced from 14% to 9.7% in 2021. Indeed, we must not relent until mother-to-child transmission is completely eliminated. As we all know, HIV response is resource intensive. In light of the Kenya Vision 2030, that among other things seeks to achieve an AIDS-free generation. My administration substantially increased contribution of domestic resources to HIV response from 18% to 38% currently. As a government, we are glad to note that our efforts in HIV response are bearing the intended fruits. The national trajectory is promising, placing Kenya, I believe, on a path towards eventually ending this pandemic. And in this regard, I today also wish to commend our researchers, policy experts, programmers, civil society organizations, and also our development partners for these achievements. Today, Kenya plays host and mentors many other countries on learning missions due to some of the successful interventions that have taken place here. Ladies and gentlemen, this year our theme is to end teenage pregnancy towards eliminating inequalities as well as new HIV infections. This theme today is a call to action for our country to address what all speakers before me have stated, and that is the unacceptably high number of teenage pregnancies. The recently recorded high incidences of teenage pregnancies in the country undermines Kenya's socio-economic development and negates the progress made to end HIV as a public health threat. Teenage mothers today are at greater risk of poor health outcomes, as we have heard from our two young people, such as premature birth, low birth weight, and prenatal death. And as our country looks forward to reaping the demographic dividend of our youth, the intertwined issues of HIV and AIDS, as well as teenage pregnancies, threatens to rob us of this promise. HIV-related stigma and persistent gender-based violence remain unabated, undermining community-led efforts despite 3 decades of our concerted national response. And so today, I once again call on all officers in national government and also in our county governments and also community leaders and all stakeholders to scale up context-specific solutions to end teenage pregnancies in the short term. Fellow Kenyans, despite the noted milestones, I am also aware that HIV response in Kenya faces many challenges. Indeed, the emergence of COVID-19 has shifted global attention away from other critical health issues such as HIV and AIDS. But as a government, we have taken measures to ensure that the gains made in HIV response are safeguarded. We recognize that HIV remains one of the world's most significant public health concerns, and what is more of our concern is that HIV disproportionately impacts the most vulnerable members of our society, the poor, marginalized, children, women, adolescents, and young adults. Further, the epidemic continues to present strongly in the 15 to 49 age demographic, who form the most productive demographic of any society. Therefore, we must sustain the gains, accelerate progress, and bridge the gaps that stand in the way of eradicating this pandemic. Allow me to note that every year, Kenya requires 25.4 billion to procure HIV prevention and management commodities. Over the past few years, donor transitioning has occasioned serious commodity security challenges that have threatened the continuation of effective treatment for the 1.5 million people living with HIV in our country. And it is on this basis that today I do direct the Cabinet Secretaries for Health and the National Treasury to jointly work on a solution to secure the essential HIV management and prevention commodities and other strategic public health programs. In particular, the country must now explore options for partnerships for local contract manufacturing of these commodities so that we are in a position to continue helping our people. I have also further taken deliberate efforts to reform the Kenya Medical Supplies Agency to ensure that our supply chain remains efficient and effective in delivering these essential commodities to the last mile. We are also closely monitoring the COVID-19 related disruptions on the global supply chain and have put in place contingency measures. So, ladies and gentlemen, a healthy workforce underpins the sustainable social economic development of any country. And we acknowledge that the development of our country will not be fully realized if preventable diseases persist unchecked. In recognition of the foregoing, my administration will continue to prioritize investments in the health of our people by bringing services and facilities closer to them. Over the last few years, we have tried to stay true to this commitment of the universal health coverage. We are invested in human resources and state-of-the-art medical equipment and increased the number of health facilities in all our 47 counties. Indeed, today the total number of public health care facilities have risen from 4,430 to 6,342. We have also seen our human resource for health over the same period of 8 years increase by an extra to 74,172. With this increase, we are better able to attend to our HIV mitigation needs and bring them closer to our people. As I conclude, let us remember that prevention remains a key strategy for addressing not only HIV, but also other health challenges. Prevention is better than containment or cure. Each member of society should be a public health ambassador, advocating for the safe and responsible behaviors that will lead us to victory over preventable diseases such as HIV/AIDS, COVID-19, amongst others. Together we can surmount any challenge, but only if all stakeholders play their respective roles. And once again, today I thank the county government and the people of Nakuru for hosting us here today. I also appreciate the efforts by the Ministry of Health, the National Council for Population and Development, and all concerned parties. And on behalf of a grateful nation, I also, most importantly, wish to salute all our healthcare workers for the excellent work and resilience that they have shown.